breast, lung, colorectal, cervical, prostate. Most Iowans at some point in their life are eligible to be screened for these kinds of cancers for free.
But ask yourself, do you know when you should be screened? If the answer is no, you are not alone. However, these Iowans are working to change that.
It's been crazy, and to have my mom and my dad here, my sister with us.
A decade later, that trip is still one of JT Garcia's fondest memories.
That moment and that day with my friends is something I'll never forget.
Hitting a home run for Johnston in the Little League World Series. And who was there to witness it?
For her to have the courage to going through the treatment to get there, it was just an honor to have her be able to watch that moment.
JT's mom, Jen, had been diagnosed with stage 4 pancreatic cancer. She was in the stands in the middle of a live interview on national TV when the home run happened.
It was just an unbelievable feeling, just proud of him, knowing how happy he was at that moment just brought tears to my eyes.
Her goal was to just inspire one person and one family, and to have that moment, she got to inspire millions of people.
Just a few months later, Jen was gone.
How much of her is in what we're here talking about today?
Yeah, I would say a lot. We know we can't prevent all cancers, but we know if we catch cancer early that we can save more lives.
Friend Mike Schreers has similar inspiration. He also lost his wife to pancreatic cancer. In fact, Linda and Jen were diagnosed around the same time.
Linda passed away 8 years ago, and I should be through the season of grief. But grief is one of those things that has no time limit to it.
That created a much deeper bond,
which would eventually forge Cancer Screen Iowa, a website and mobile app that will provide Iowans a one-stop shop to help remove any roadblocks to getting screened.
The top 3 reasons why people don't get screened: number 1, they just don't even know the guidelines. They don't know the awareness. Number 2 is cost. And 3, it's access to a primary care doctor.
Joe, a regional VP with Aflac, says a client, Cook County, Illinois, helped inspire the idea. That county now offers free prostate and breast cancer screening to all eligible residents within 30 days of their birthday.
And that started 1/1/25. At the end of 25, they had a 17% increase in breast cancer screening, a 14% increase in prostate cancer screening.
He worked with JT to put together a proposal that would benefit the state of Iowa amid our growing cancer rates. And they turned to renowned Des Moines oncologist Dr. Richard Deming.
The honor and horror of, being involved when Joe's wife Jennifer was diagnosed.
To help fine-tune their approach.
Are Iowans getting screened at rates that they should be?
No, we are not as good as average.
He says the benefit is plain as day.
Screening reduces death.
Because testing Iowans who might be at risk of developing a certain type of cancer.
It just allows us to find it when it is curable.
Deming says Iowans who don't have a primary care doctor or a strong medical support system
you shouldn't have to memorize, what age do you start getting screened for this cancer or that cancer?
And should know that it's free for most of them. Because of the Affordable Care Act, 95% of eligible Iowans are covered for cervical, breast, colorectal, and lung cancer screenings by either private insurance or Medicare and Medicaid free of charge. Most are also covered for prostate, but could incur some shared costs. That's why Cancer Screen Iowa says in our state, awareness is step 1. They've turned to Justin Miller to help develop the website and app to help keep you and your loved ones accountable.
In my close family circle, I can invite others, and I could share or not share, or choose to share that information with them. So if my father has not done his tests, I can nudge him and say, hey, by the way, I noticed that you haven't gone in and got your screenings as we discussed.
They hope employers will get involved by providing notices to remember to get screened and linking to the Cancer Screen Iowa app and website. And down the road,
part of our goal long term will be to find the funding so that no matter who you are or your financial situation, that you can walk in and you can get a mammogram if you're 40 and a female.
Last month, JT graduated from the University of Northern Iowa. Another moment he'll never forget. One Jen wasn't there for, because cancer claimed her life. It took Linda's too. But
When life ends, love doesn't.
And part of sharing that love is making sure other families don't have to go through what we did.
And as I mentioned, both Jen and Linda died from pancreatic cancer. Right now, there is no early screening for that. But earlier this year, the National Institutes of Health said research it is funding has identified new blood markers that may detect the disease in its early stages. So we'll continue to keep an eye on that. The Cancer Screen Iowa website is now live and ready for anyone to use. It is free of charge. Just go to cancerscreeniowa.com.